Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now, today we will be studying about esophagus. Esophagus will be divided into the two parts, okay? So, this is the first part in which we are discussing about the normal anatomy and what are the other things we need to know before jumping onto the systemic one. So if I talk about esophagus, it's a muscular tube about 25 centimeter long that connects your pharynx to your stomach, allowing the passage of foods and liquids. This we all know. We have read in our first year. Not even in our first year, we have started reading our esophagus from our 7th standard. If I talk about the anatomy, the length is 25 centimeters. It begins at the level of C6 vertebra. Then it is divided into the three parts. What are the three parts? Cervical part, thoracic part, and your abdominal part. See guys, this is the histology. It has mucosa layer, submucosa, muscularis propria and adventitia. So this you need to remember, mucosa is a stratified squamous non-keratinized epithelium. Then you have the submucosa that contains your glands. Muscularis propria that is divided into upper 1/3, middle 1/3, lower 1/3. In the upper 1/3 you have the skeletal muscles, then in the middle one you have the mixed, and in the lower one you have the smooth muscles. In the adventitia, you have the outer connective tissue. Next is about the physiology. If I talk, then the function of esophagus is to transport food from your mouth to the stomach. Mechanism is, you have read in your physiology that esophagus follows a peristaltic movement. Okay, esophagus follows a peristaltic movement. Like even if I am swallowing something, so this esophagus is following what movement? My esophagus is doing a peristaltic movement. You just do yourself, just try to drink some water or try to swallow some food. You will be able to appreciate the peristaltic movement. Now, blood and the nerve supply, arterial supply, the cervical one is through the inferior thyroid artery, thoracic one is through the aortic branch, and abdominal one is through the left gastric artery. Then you have the venous drainage, for like azygous vein that drains into your SVC, and left gastric vein drains into your portal vein. If I talk about the nerve supply, you have parasympathetic nerve and the sympathetic nerve. In the parasympathetic nerve, it is vagus nerve, and in the sympathetic one, it is cervical and sympathetic trunks. What are the common disorders? We will discuss the common disorders in details in our second part. Let's just study what are there. You are having GERD, that is gastroesophageal reflux disease, 𝗲𝗵𝗵𝗴𝗿𝗺, esophageal varices, esophagitis, and esophageal carcinoma. These are the disorders. What are the clinical features? In the clinical features, there will be dysphagia like difficulty in swallowing. There will be odynophagia, painful swallowing, heartburn, regurgitation, and weight loss. Investigations, what I will do barium swallow, endoscopy, esophageal manometry, pH monitoring, and biopsy. What is the management? See, management is different for different. If the person is having GERD, I will give them antacids, proton pump inhibitors, and lifestyle modification. Next thing is, if the patient is having eclasia, I will give balloon dilatation and Heller's myotomy. It is a surgery. Which is done. Then if the patient is having esophageal varices, I will give them beta blockers and endoscopic band ligation. If the person is having carcinoma, I will give them surgery, radiotherapy, and chemotherapy. In the summary, you need to know that esophagus is a muscular tube that transports your food and has upper and lower sphincters. Disorders are often with dysphagia and reflux. This was all about the part 1 of esophagus. I hope you have understood it a bit. Okay, so if you have any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.